Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right.
I'm April Martinez.
And I'm Gavin Courtney.
And welcome. Good morning, Belize. Thank you so much for joining us this morning.
Yep.
Gavin, how are you?
I'm doing great. Yep.
It's our first time together.
Definitely, it is. It's fun trying out something new.
Yes, we are. Well, we're here together because our friends are in San Pedro this morning.
Yes, we've got Paul and Marlene, and they are live in San Pedro. They are covering, of course, the CARICOM Heads of Government meeting, and of course the SICA CARICOM Summit, which is also happening as well. So it's a very exciting time.
It is a very exciting time. I'm kind of jealous that they ended at San Pedro.
Exactly right. I'm pretty sure like the sunrise would look a bit different from there.
I'm pretty sure it has, and it was raining this morning.
Yes.
Yeah, but you know. As always, we're excited to have so many leaders coming in from our Caribbean neighborhood for the first time in 2 years, meeting up in person to discuss all of the current issues that are happening within and around our region.
No, absolutely. So it's a great initiative, and it's a great chance for people to come together. And I believe actually we now have Marlene and Paul live from San Pedro. So we're going to check in with them, and we're going to see what they have been up to and what we can expect for today's event. So let's go right to Marlene and Paul.
Hi.
Oh, there they are.
There. That we are having a little bit of difficulty hearing them, but I think once we get that started up, we'll be able to listen in more on what's happening over there in San Pedro. But for right now, I think one of the more trending conversations for today is the lifting of the curfew.
Absolutely.
Yeah.
Yes, so that announcement was made yesterday by Prime Minister Briceño. So the curfew, which comes to an end as of today, really, as of the 1st of March. So that was a very big announcement. I know that it's one that a lot of people are happy to hear about after 2 years of having different levels of curfew.
I think they had mentioned that it's going to be the month of testing to see how it goes. We're going to go check back in April and see how the cases have been doing, and of course how the flow of tourism has been going as well, which I think for the most part we've been doing well, right? I think for the most part we've had a large influx of tourism via the airports. I think it was yesterday that they were announcing that the insurance is working and so forth. It's just that there's a large crowd of people that are coming in. People have been purchasing their insurance, but it's that flow of tourism with people having to check in with that insurance that is making the airports a little bit crowded.
Yes, and of course, one of the issues there was that was whether and how the message that the requirement was needed got to the tourists, and who should be spreading the message, whether it's on the airlines, whether it's on the hotels who make the reservations, whether it's on whose responsibility is it? But it's definitely interesting to see how it's rolled out, and it is encouraging to see the numbers roll back. And I think that we've got our technical issue
sorted out.
So let's try and go back to San Pedro. So Paul and Marlene, if we've got you live, let's take it away.
Morning, guys. Yeah, we are back with you. And I was saying, Gavin, you're right. The sunrise definitely is better from our point of view. And while you had some showers of blessings, it's a beautiful morning here in San Pedro. And we're excited to be chatting with you guys.
Yeah, and I was agreeing with Marlene that in fact the sunrise is very beautiful, and if I were you guys in studio, I would definitely envy me. Not that it's not a beautiful sight or beautiful scene in studio, but out here it's really beautiful. We've had a lot done yesterday here on the island in terms of arrivals. We saw leaders arrive, we saw representatives of states arrive. And we have a packed schedule for this morning as well, starting of course with the morning show.
Yes, so yesterday evening you were able to see the broadcast of the arrivals, and that was really a great experience. But today officially the work has started, although we know there's still meetings and preparations taking place. Breakfast is lined up just next to us. So the delegations are going to be heading into that session. The opening session will be at 9 a.m. this morning. We'll be able to bring that to you live as well. And then they get to work with a very packed agenda.
Yeah, what I was able to see yesterday, just going back to the arrival, I was able to see, how would I word it? I was able to see my people and more of my people and more of my Caribbean people, Marlene, my brothers and sisters from the Caribbean, people that are oftentimes at a distance from us, people that we don't ordinarily get to see on a daily basis. It just felt good to be able to connect with those people, even if it wasn't physical or verbal connection, just being in the same space with leaders from across the Caribbean. That felt good, and I'm sure as the nation watched the arrival coverage that there was some sense of pride. There was some sense of pride across Belize as well as across the Caribbean.
Of course, but I heard you guys chatting about the other big news as well. We know that there are changes in restrictions, and so today people are waking up trying to come to terms with the fact it's been so long. I was telling the team last night, I said, what a perfect place to be when they lift the curfew right here in San Pedro.
Yeah, I mean, it's all work though, so.
So I know one of the things this morning, we do have a live interview lined up very shortly with Prime Minister John Briceño, and it is an opportunity for us to be able to hear from him about the preparations that have gone into these high-level meetings that are going to take place. Putting it into perspective, this is the first in-person meeting of CARICOM heads since the start of the pandemic, and so a real signal as to the shift as to where we are in this phase of the pandemic.
Yeah, and there is also a lot to talk about. There's a lot to discuss in these high-level meetings, and we will be getting into some of those topics with the Prime Minister this morning.
Yeah.
In studio?
Okay, you guys had also mentioned that there's a packed agenda this morning. Okay, you guys had also mentioned that there's a packed agenda this morning. Okay, you guys had also mentioned that there's So why don't we talk a little bit about what you're expecting to see this morning in terms of the meetings, and then just generally throughout the day.
Session, we are going to see the outgoing chair of CARICOM, the Prime Minister of Antigua and Barbuda, who will be joining us virtually via Zoom. He's going to make an address. We'll also hear from the CARICOM Secretary General, and of course our Prime Minister, Honorable John Briceño, who is the current chair.
And directly after that, Gavin, after that opening session, the room will be cleared. Of the press. We kind of got a sneak peek of what the setup in the room looks like. It's definitely official It's definitely a high-level meeting type of setting, and so the press will be cleared from that room for the period of the next 2 days. So we're talking for the entirety of today as well as the entirety of tomorrow. Well, at least up until tomorrow, late into tomorrow afternoon, early tomorrow evening, where a press conference is scheduled for us to engage with those who are present on some of the results that came out of, that will come out of that Tuesday and tomorrow, Wednesday's meeting.
Any idea of the topics that are going to be discussed today or tomorrow?
There's a wide range of topics. Remember, I think they're taking opportunity of the fact that one, this is the first in-person meeting, but two, there's just a lot happening at this time, and so we're going to definitely see on the agenda COVID-19. We're going to see talks as it relates to the health impacts of COVID-19 on the Caribbean, as it relates to vaccinations, the lifting of measures. As we're seeing here in Belize currently, we're going to see stuff on education as it relates to COVID-19 as well. We're also going to see stuff, the conversation on the economy and economic recovery across the Caribbean as it relates to COVID-19. And the conversation surrounding the economy, of course, will divert directly into the conversation surrounding CSME and the implementation of a single market and economy community. Then we also have talks.
Can't forget that climate change is also a big part of the conversation here. And following COP26 in Glasgow at the end of last year, this is an opportunity for them to get together and be able to assess the results. There were particular aims that they were hoping to achieve, but of course it's a time to take stock and of course plan ahead for COP27. So there's a lot of work that's going to be happening over the next 2 days here in San Pedro.
And I just have to mention, because I feel it's one of these significant issues, and that's the matter with Haiti and the instability there as it relates to the system of governance and as it relates to security, home affairs and home security within that community. As a brother sister nation, the Caribbean wants to see stability in Haiti. We want to see sound leadership. We want to see the safety of our brothers and sisters, and so I believe that will definitely be a high priority on the topics of conversation.
A number of topics, but April and Gavin, we are going to set up for an interview over here. I know you guys have some housekeeping to take care of there, and we will be joined by Prime Minister John Briceño, who will be taking some time out of this very busy schedule to be able to share with us his expectations, and of course looking forward to the CARICOM-SICA meeting, which follows on Thursday. So we'll send it back over to you guys, and when we come back, we'll have that live interview from Grand Caribe in San Pedro.
Awesome. Thank you so much, Marlene. Thank you so much, Paul. And we can't wait to see that interview from you guys in a few. But yeah, let's head into our show for today. Today we will be having the interview with John Briceño that Marlene and Paul will be covering with you all via Zoom today, and he's going to be discussing about the CARICOM-SICA summit, as well as the other trending topics that are going to be held in the meeting for the next few days. I feel like 2 or 3 days is not enough to cover all of these, but that is going to take place. And then we're going to be having, for the second segment,
yeah, we are going to be having, we're going to be checking in with some health officials, and they're going to be talking about the rolling out of NHI services countrywide in a phased approach. And then we are also going to be closing off with our third segment. We're going to be talking all about Women's Month, and we're going to be talking about a new initiative to break the bias. But of course, before we get into the full show, we do have our eye opener.
Yes.
And our eye opener is taken from dailyhome.com, and it goes something like this. Your most important work in this lifetime may not be your job. It's a conviction within your soul. recognizable if you allow it to shine. Our life's work is not always what we do to make money, although we often think it should be. And sometimes this way of thinking prevents us from seeing clearly what it is. It may be the work of having children, caring for them, and running a household. The way we know our life's work is by how we feel when we are doing it. When we are deeply unhappy, depressed, or subject to one illness after another, this may be due to a sense of disconnection from our life's work. At times like these, finding the work we are meant to do is an essential act of healing. Most of us remember a time when we felt fully engaged in some act of work, service, or creativity. And it is here that we may rediscover the work that we are meant to do now. On the other hand, it may be time to explore what inspires us through volunteering, taking a class, going back to school, or just doing whatever it is we long to try. We all have callings, and when we find them, we owe it to ourselves to nurture and protect them. Because while they may or may not be our livelihood, they are the keys to our well-being.
You know, it reminds me of this other quote that says, if you're happy doing your job, you'll never really be working, you know? And it comes into fruition when we talk about the things that we think we have to do in order to make ourselves be productive or useful. And sometimes it surrounds the fact that you have to make an income, right? And oftentimes when you're doing something that brings you happiness but it doesn't bring you income, it kind of makes you feel like you have a dilemma, right? For example, if you are somebody that loves to do your volunteer work more so than you do your actual day job, you find yourself spending more time doing your volunteer work and less time doing your day job. And some people will say that that is not efficient. That is not sustainable because you're putting more of your time into the things that bring you joy. I don't know how you see it.
Well, I think that the eye-opener, it raises a great point. And the part that I really liked was the mention about when you do, it definitely, it's definitely true that a lot of the times, you know, our passions and our joys are not necessarily the same things that you can make a living from all the time. But, you know, what can happen though is if you sort of ignore or suppress that thing that really does give you joy or give you things, then of course that does take a toll on you as well, spiritually, mentally. If you cut yourself off from those things which really do make you happy, then it does have a big effect. And so I think that you know, for me and for some people, I know what has been the thing is that even if your day job, as it were, isn't the thing that you're passionate about, you can still find ways to involve what you are passionate about in your life. Whether it's, or maybe you can just start slow. You can say, well, I can dedicate at least just 15 minutes a day to this, and then maybe you can find out along the way, maybe you can dedicate your weekends or maybe one evening after work or something. You know, or one of the other things which I find as well can be helpful as well is to find other people who share those interests. So at least you can talk to someone about it.
Very, very true. You don't have to go through that journey alone. And I like the part that it says we all have callings. And when we find them, we owe it to ourselves to nurture and protect them. You know, sometimes we go through life doing one thing and not really knowing what else is out there or what else we're capable of until we take that leap and we try it. And when we realize that that is something that you love, you kind of dedicate more of your time to it. You want people to know about it. You want other people to be just as passionate about it.
No, for sure. And I think one of the other things about the eye-opener that I liked is that it also took account of how varied those callings can be. It doesn't have to be a job. It can be spending time with your family or raising children or anything else which really makes you happy. But that is a great positive note to end on. So definitely do what you enjoy and makes you happy. But we are going to be checking in with our weather right now. And we've got our forecaster on the line. We've got Catherine.
Catherine, good morning, Catherine.
Good morning, April and Gavin. Good morning.
How are you?
I am doing good. Not going to complain about a thing. Just giving thanks and praise. That's all.
I hope it's the weather that is keeping you so positive this morning.
The person that called us now, I tell them the reason why I'm so happy, but I'm not going to say it on the air.
Ooh, okay. We'll talk later. We'll talk later.
Yeah, we'll talk after. All right. So, Catherine, tell us about what we can expect for today. What does the general situation look like?
Okay, the general situation, we have a light northerly airflow that continues to dominate our weather, and that will give us mostly sunny skies today with a few cloudy spells. Our high temperatures will range from 84 along the coast to 88 inland and 77 over the mountains. Tonight, the skies will be partly cloudy and low temperatures will be 72 along coastal areas to 62 in the higher elevation and 66 over inland areas. As for showers, you expect a few showers will continue to develop along southern coastal areas. As you look at our radar and early satellite pictures, you can see these showers are along southern coastal areas and offshore. But by afternoon, we expect that these showers will become isolated. Then tonight, we expect a few to isolated showers to develop mainly along northern and coastal and central coastal areas of Belize. The winds will be out of the north to northeast, 5 to 15 knots. The sea state will be light chop. And the outlook for Wednesday is for a few coastal showers Wednesday morning. Thereafter, the showers will become isolated and we go back into basically fair weather.
Awesome.
Okay, so some good weather to expect for the rest of the week then.
Yes, we expect fair weather right through for up to my forecast go up to Saturday. Is for generally fair weather to prevail with only isolated showers. Okay. Beautiful weather to go to the beaches and the Keys, Gavin and April. Nice weather, man.
Sounds great. Good. I'm very jealous of Marlene. I might join her later.
All right.
Okay, all right.
Have a great day, Catherine. Thank you.
Hello?
Okay, yes, Catherine. All right. Oh, actually, this time of year, we normally are also giving our fire forecasts. Is there anything to look at?
I'm sorry, we do have two other forecasts that we usually give all this time. We have the sargassum forecast, and there's no significant influx of sargassum mats on our beach, and that will continue for the next few days. And for the fire forecast, the risk for forest fires or hotspots will continue to be low for the next 24 to 48 hours. So it's good weather all around.
Okay, that's great. So that sounds good for the long weekend that's coming up.
Yes.
All right.
Yes. Okay, then enjoy and have a great day and continue to stay safe.
All right. You too, Catherine. Thank you so much for that update.
You're welcome. Bye-bye.
Bye. And of course, we want to say thank you to Catherine Cumberbatch for putting together today's forecast. And as we mentioned a little bit earlier, we're starting off the show with an interview with the Prime Minister, live from San Pedro with Marlene and Paul.
Yes, and then of course afterwards we're going to have in studio Dr. Ramon Figueroa and Dr. Marco Mendez, who will be discussing the NHI program, the countrywide phasing that they're going to taking that approach. And then lastly, we're going to have the kickoff to Women's Month. March is Women's Month, and we'll be having in studio the National Women's Commission, and they will be discussing the theme Break the Bias. So I'm very, very excited about that conversation for today.
Yep. And because it is Tuesday, just before we close off our show, I am going to be talking about some trending social media topics on Trending Talks Tuesdays, and that's our show for this morning.
Yes, very exciting topics. I'm very excited for today. But of course, we're going to go out and take our very short break, and then we come back with Marlene and Paul via Zoom at Ambergers Key.
In these trying times, Smart is here to lessen the burden. Smart's reduced roaming rates save you while traveling. Calls back home are a low 35 cents per minute when visiting Canada, the US, and Mexico, or pay as low as 50 cents for calls when visiting countries in the Caribbean, Central, and South America. For the month of February and March, enjoy an unbelievable low rate of 30 cents per megabyte when roaming with mobile data in Canada, the US, Mexico, Central America, and the Caribbean. Whether you are a business traveler, studying abroad, visiting loved ones, or just traveling for pleasure, Smart's new roaming rates have got you covered. Roaming in China, Europe, Central America, South America, and the Caribbean is as low as the cost of making a local call. It's that low. Smart's roaming coverage continues to grow, so you can also enjoy affordable roaming rates in several destinations across the globe. For more information on rates to other countries, visit our website or call 1090 for more details before you travel. Smart, bringing people together.
After a rough week of school, Jake and his friends decide to treat themselves to frozen coffee. And since they don't have cash on them, they decide to use eCash. With eCash's geolocation feature, Jake can easily find the nearest coffee spot. With eCash's built-in option to split bills, Jake can pay the bill and his friends can reimburse their portion of the bill. Jake scans the merchant's code and confirms payment. Jake then views his transaction history and taps on the transaction recently made, then taps the split the bill button where he selects the evenly option to evenly split the bill. The application splits the bill automatically. His friends receive and accept the request. Geolocation and splitting the bill via eCash makes Jake enjoy his digital lifestyle.
Connecting people. Creating memories.
Hey guys, so here we are at the Glaze Out Kitchen. I just prepared this amazing broccoli.
Sharing a smile. Next Gen, the ultimate digital experience.
So we're back from San Pedro Town Hamburger's Key, and we have on set with us, as we promised, Prime Minister John Briceño. Good morning, PM.
Good morning, and it's certainly a pleasure to be here. Yeah. Of course, as Marlene said, I did not have to wake up very early to be able to get to Belize City.
You just walked right downstairs. Yeah.
Yes, I walked down the stairs, and you forgot a very important part, Grand Caribe. I think Sean would really appreciate if you said we're at Grand Caribe in San Pedro, Hamburger's Key.
That's right.
But it's a pleasure to be here, and the weather is holding up so beautifully for us, especially for our guests.
Yeah. And PM, we know you have a number of engagements lined up. You're sneaking in time before the session starts as well, so we appreciate you taking the time. Let me just start off the bat, of course. Let's get in some of the Belize matters first. A lot of people are happy with you this morning with the recent announcements. You said you were musing at the memes that are coming out as well, right?
There are some very funny memes, and some people would not appreciate the humor on it, but more importantly, Marlene, is that I think, as a government, we've done everything possible to protect Belizeans. We've done the testing, the education, the vaccines, the medication that's necessary when you get sick. And now that we've seen with the Omicron variant that has spread pretty much across the entire country, it's more like a bad flu. And we believe that we need to now deal on the personal freedoms of people, opening up businesses. A lot of people have been suffering, especially the entertainment business, the restaurants that have been really under a lot of stress. And we need to move now the full responsibility from the state to the individual. We've done our part. Now you as a citizen need to be able to be responsible for yourself. Get vaccinated, and if you don't feel safe, then wear a mask. That kind of thing. So, and I certainly appreciate the people, the ministry, the Minister Bernard, and certainly Minister Shabat before, and the staff at the Ministry of Frontline Workers, from our health workers that have done a tremendous job. I mean, I must name Melissa Diaz Musa. I mean, I she was telling me that she has not had a holiday, for the past 2 years, and like her, so many of them. So we are very grateful to them. And now I'm hoping that Belizeans are going to act more responsibly and get vaccinated.
Of course, the details matter as well, and I understand that you are still going to flesh out some of the specific requirements when it comes to vaccinations.
Yes, the details matters, but pretty much we're relaxing most everything. And we're using the month of March, and by April 1st, we're going to be relaxing everything. but insisting on the vaccination, that people need to get vaccinated. We're insisting if you're going to leave the country, you must be vaccinated. And we're looking in certain areas where we believe for you to be able to access that you must get vaccinated. Because by being vaccinated, then you protect yourself and you also have to protect your family and your loved ones.
Yeah. What was the advice from the medical task force? Were they on board with this decision?
Surprisingly, yes. I think pretty much they were on board. They by themselves are also, they are fatigued, and they have seen that as a country that we have done everything possible to protect people, and now it comes to a point of where it has to be some sort of personal responsibility. We will still have testing available, but we will not be testing the way we do now. And once you get sick, you can come to the hospitals and get the treatment. And of course, then we're hoping that then you will be able to isolate yourself at least for a few days. I know about 5 days now, I think, in the United States and the other countries they're doing. And so we hope to be able to follow suit.
This follows what we're seeing internationally, and I know, PM, from the point when you were in opposition, you were saying we have to learn to live with this virus.
Unfortunately, we do. And yes, I've been saying it from when we were in opposition, that we should not be afraid. I was pushing for us to open up the airports from July, you know, and government back then, and rightly so probably, they were very afraid because we did not understand the COVID-19 as well as we do now. And the variant back then was much more dangerous than the one we have. But we have to move on. I mean, and we have done a tremendous job in opening up the economy, turning things around. By the last year, we ended up having 12% GDP growth, something that nobody expected. Even the IMF, they were floored. You know, the team leader basically told me, I've never seen any country in the world do what you guys did in 1 year. Of course, constantly cautioning us, you're not out of the woods, and that's what I have to tell my colleagues. You know, we're not out of the woods, we're getting to almost at 2019 levels, but we have to remember that 2019 we were already in a recession. So, I mean, it's so bad things have gotten, and that we need to fix.
Yeah, it's a part of the details, but I just wanted to be clear about the fact that April 1st, we could see the reopening of nightclubs and bars.
Yes. I'm not sure if they're doing it now. I think they are, but definitely by April 1st, we're opening up everything.
So this relaxation is just easing us into April, where you expect
yes,
no
where then
restrictions.
we pretty much have almost no restrictions, with the exception of the vaccinations. Let's not forget, there will be some restrictions in areas that you can access, or in particular, leaving the country. You must get vaccinated. And also other countries are demanding for you to be vaccinated to be able to enter their country.
No, Belizeans obviously seem to have been ready for this move just by the response. I would imagine that the government reserves the rights to re-implement any restriction if the need arises.
Of course, and we've said that. And I need to remind our viewers on Channel 5 and our citizens that whilst we're easing up the restrictions, we hope something else does not, God forbid, pop up, and we may need to do some other restrictions. We don't know with COVID-19, but it seems now that it's the variants are getting, quote unquote, weaker. Don't quote me, I'm not a doctor, I'm not a scientist, but at least that is what we're getting, and because of that, we felt it's time to ease the restrictions.
We do hope it stays that way, of course.
Yes, please. We can't handle it. It's going to be tough.
Let's shift gears to the purpose of your time here. And you know, yesterday we were looking at the arrivals as all the heads of the delegation and heads of states came in, and now it's time to work. A part of that agenda is looking at post-COVID recovery, the economic challenges that countries across CARICOM has faced. Let's talk about your point of view and some of the agenda items.
Well, certainly COVID-19 is big in the agenda, and CARFA, the body from CARICOM, will be giving us a report. But looking very quickly at Belize, I mean, by 2018 we had a 50% poverty rate. By the end of 2020, when we got into government, we were already at 60%. And Belize is no exception. The rest of the Caribbean were going through the very same thing. Belize has an advantage over the Caribbean is because we have agriculture. And agriculture last year led initially the growth in the economy. When Minister Mai said, well, let's sell our cattle, let's sell our products right across the border. We did everything possible to get that going. So the issue of poverty, the issue of vaccine access, which continues to be a problem, the issue of access to the medication that is coming out now that you'll be able to use when you get COVID-19. These are things that that we are facing on a daily basis, and then also the financial recovery that countries like Belize, developing countries like us in the Caribbean, we're small developing countries, but they look at the GDP, and because of the GDP that we have, they're saying we are middle income countries, and that is why then we cannot have access the cheap financing that the IMF and the World Bank and other IFIs have been doing. That's why we're saying that we have to change that kind of testing on the necessity of countries, and Belize and the Caribbean is certainly one of them.
Yeah. How is it, on the topic of vaccinations, how is it that a nation like Belize has a surplus in that they're expiring on us, while other countries within the Caribbean, our community, see the deficiency in this area?
It's expiring because our citizens sometimes can be hard-headed. They don't want to go and get vaccinated. If they have been going to get vaccinated, the vaccines would not have been expiring. But secondly, I think we also have to give credit to our government. And between my office and the Foreign Ministry office, Minister Courtney, we embarked on an aggressive, what we call vaccine diplomacy. Pretty much asking countries to help us. I mean, we got from India. Remember, Barbados was the first to share 1,000 of their vaccines, and then we were India definitely was helping us. Mexico, United States, and even the United Arab Emirates. I mean, they sent some of the Chinese vaccines. So because of that, we ended up having enough for everybody. We only wish that more people would be more responsible in getting the vaccines and getting vaccinated.
No, definitely. We recall that first batch that came from Barbados was a huge help for our frontliners.
It gave us a sense of hope.
Yeah.
Because we at that time, PAHO, the vaccines that we were trying to get through them, was nowhere in sight. And then we also bought the Johnson & Johnson vaccinations through CARICOM. That CARICOM organized it, and then we as a country bought I think 100,000 doses through South Africa.
And I think that's a great example of how the Caribbean community has kind of been trying to get through this together. The opportunity today, I know, and one of the agenda items is looking at the implementation of the CARICOM single market and economy. And we can talk about it broadly, but I want to bring it more specifically, where Belize has faced challenges in even taking it to the court with the export of sugar. Do you feel that Belize has benefited sufficiently from the implementation of CSME?
We definitely have benefited, but I think there's a lot more opportunities for Belize. Belize can be the breadbasket of the Caribbean. I mean, we have the land, we have the agricultural land, and we have the people that can grow the products. One of the challenges is the transportation, moving from Belize to the Caribbean. And next door is Mexico, next door is Guatemala. So there are certain geographic disadvantages that we have. But if we're going to be a part of a single market economy, then we expect that our bigger economies in the Caribbean, Jamaica, Trinidad, for instance, that then they buy within the Caribbean. In our case, we have the sugar. Caribbean shipping chicken has been trying to get their chicken into the Caribbean, and they've been starting with Grenada, but constant roadblocks, and it's again the business communities, not the government. They already have been used to doing things in certain ways. In the Caribbean, they would go and buy from the United States, but if they were to pay the duties, the taxes that were required to import it, they would not be able to compete against Caribbean chicken. Or they would not be able to compete against the sugar we produce in Belize, and the vegetables that we produce, and the meat that we produce. There's so many things that we can offer them. I mean, fresh meat and not processed meats or things that have been refrigerated for months before then they buy.
So how does a meeting like what's going to happen today change that dynamic? Because naturally businesses want to go with large producers where they can get cheaper prices rather than buying from within the Caribbean where it may be a bit more expensive.
Well, if they were to pay the taxes that are required to import those, you see, they get a special derogation from CARICOM to say, oh, we can't get the sugar from Belize, does not meet our standards. When we know it does, and then they get the derogation, and then with that, then they could import sugar from elsewhere without paying the tariffs that are required to be paid. So if the tariffs are enforced in the Caribbean, we can compete. And we have been doing our best to be able to buy products from, from Grace Kennedy, for instance, from Jamaica. We buy products from Trinidad and Tobago, a lot of their products. As it is right now, we'll have to be working on the condensed milk because Jamaica has made a case to CARICOM that they have enough condensed milk to supply the entire Caribbean. So now we have to change our tariff structure when it comes to
because we import from outside of the Caribbean.
Import outside of the Caribbean, although we do import from
Jamaica.
Kennedy, also from Jamaica. But that's just a simple example of changes that has to be done. We need to understand that that if we can buy from one another, we help one another's industries, we help one another's people, because we create we're looking at a $60 billion market in the Caribbean. It's a big market for small countries like ours. And also then if we can then work together, then we have a bigger voice, a bigger bargaining power in when wanting to buy stuff for the Caribbean. So the single market and economy is the way to go. And it will take some more dragging and pushing and doing everything possible to get it going. And we must give Prime Minister Mia Mottley credit for the incredible work that she's been doing for the past year in trying to push us, as countries to be able to ensure that we can implement as best as we can a single market economy.
Now, speaking of PM Motley, I do think one of the issues on the agenda is looking at climate change, and both you and Prime Minister Motley at last year's COP really spoke out strongly against the resistance of countries that are the greater producers of the
greenhouse gases.
Yeah, thank you, the greenhouse gases. Now, taking into consideration the results of COP26 and understanding that together there's far more influence in the Caribbean, how do you use this meeting as a catalyst for COP27?
Well, what we need to do, first of all, we need to take a look at we will discuss COP26 and we will get a report from the 5Cs, the Caribbean Climate Change the office, which is situated here in Belize, and they are going to report to us on what are some of the things now that we need to do. One of the things is that we have to set up an office that is going to be looking at what was decided at COP26 and also at the Green Climate Fund on how we could access it. I believe we can do that through the 5Cs. So we're going to be looking at that. We're going to be again continuing to push that $100 billion that they have promised every year, that the Caribbean can access it. We are the ones that are feeling the brunt of climate change, and my frustration on us in the Caribbean, we are not the ones that have created climate change. We are adding to help to keep down the gas emissions with the seas and our forests and so forth. But yet it is developed countries that have been creating that, and so now as the temperatures go beyond the 1.5 degrees Celsius, there's islands in Belize that are going to disappear. Belize City is going to be in trouble. The low-lying coastline that we have are going to be in problem. Our barrier reef is going to be a problem. So my thing has always been that let's not talk too much about adaptation. Adaptation is when you've given up. Let's talk about mitigation. How is it that we could try to hold on the temperature? What is it that we could probably have more healthy forests and coral reefs and so forth? But we need the resources to do that, and we don't have them. We have more ferocious hurricanes in the region. We have rain when it's supposed to be dry, and we have when it's supposed to be raining. We don't have it. The climate patterns have changed, so a lot of agriculture or people, when they are planting because they expect rains, it does not rain.
There's no predictability.
Exactly. So we are living that every single day. And our frustration, and certainly my frustration, is that the developed countries need to make the funding available to help us, to be able to mitigate and certainly to adapt to what's coming ahead of us.
To help communities like Monkey River, which
Monkey River is a good example.
Yes,
unfortunately, the United Nations Secretary UN would not be able to come because of the crisis in Crimea, in Ukraine, sorry. And unfortunately, he got to call yesterday. He says, there's going to be an important vote tomorrow in the UN, and so he'll not be able to get on a plane and get here on time. But he promised he's coming. He said he's so excited about what he has seen in Belize and reading up on Belize, so he has promised he will come back. But yes, we were hoping to show, for instance, Monkey River, it's disappearing. I mean, a part of the cemetery is already underwater. When you look, there's a post all the way out, which is a part of the actual village. So we are living that. There's an island, and I had a video, I think Tony Roth showed to me, where a guy was saying this was an area for birding. And now when you only see some of the dead trees because everything is underwater. So we're living it, and the developed countries do not understand or are not taking it serious enough. But what they don't realize is that you can't fight Mother Nature. New Orleans is going to disappear for sure. Many parts of Miami is going to disappear. I mean, as much as they could use all their technology and trying to put barriers, you can't fight it.
No. I wanted to switch topics a bit just to ask, as the idea of a Caribbean community is placed at the fore of the minds of Belizean people with this CARICOM intersessional meeting. What's your thoughts on the identity, the common identity of us as a Caribbean people, as a Caribbean nation, as brothers and sisters within CARICOM?
Well, Belize is in a unique position. We need to point that out. Historically, we have so much in common with the Caribbean, and our history, our governance, our music, even our skin color, I mean, the language, English and Creole. So there's a lot that have us united or gives us that kind of Caribbean identity, that kind of easygoing, open, friendly. Just last night I met a group of tourists from Michigan, and somebody told him I'm Prime Minister, and I was sitting and he called, hey Prime Minister, I want to talk to them, and he says, you all are so friendly, I mean, and that's a part of being Caribbean, the Caribbean identity. But Belize is unique in that sense, because whilst we have that, we also have the Latin aspect of culture, of music, of language, of food, and so we are straddling both areas, and we need to take advantage of that uniqueness. That is why then we have been pushing to have a CARICOM Sika Summit, which we'll be having on Thursday, where we're having some presidents from from Sika, and then if not, the ones that can't come, their vice presidents are coming, or a representative is coming, for us to be able to have a discussion between two regions. How is it that both regions can then come even together as a bloc? Because then if we have a $16 billion economy in the Caribbean, imagine bringing in Central America, we probably triple or quadruple the size of that economy. And so we have even a stronger voice. So we need to take advantage. And the father of the nation, George Price, was always talking about us, that we are the bridge. Yeah. Well, some people are saying, well, when you talk about bridge, you walk upon you. But we're thinking that we are the group that unites both.
Yeah, and I know you're very proud of hosting the CARICOM Sika Summit on Thursday. It's been 11 years.
11 years, yes. It's unfortunate that our previous government did not give the importance, or did not put enough interest in working more with Sika, so that they could bring them together to bring them together with CARICOM.
How do you actualize this idea of being a bridge between the Caribbean and Central America?
Well, it starts with people. As I said, we have a lot of the culture and etc., as I explained with CARICOM, but also we have a lot of contacts. A lot of our people now that are living here have relatives that are there, from Central America, and so now what we have to do, we have to be more active in Sika, and telling them, but guys, you know what, in the Caribbean, this is what we're doing. And let's try to put it together. So in my first meeting that I had in Costa Rica with heads, I immediately said, listen, Belize is going to be in the following year, in 2022. We're going to be the pro tempore chair and president of CARICOM. And I would want us to be able to have a joint meeting with Sika. And they immediately jump at it because they also want to see how they can tie in with the Caribbean, because it opens up a market for them. Just like then we are opening up markets for the Caribbean into Central America. So it is in our interest to be able to do so, because if we don't, then the bigger guys are going to continue trampling.
So it's investment opportunities that are available for us from both ends.
Exactly. And as it is right now, when I met President Giammattei in Guatemala, they were saying, he said, we want to expand the partial scope agreement that we have, because then there are many Guatemalans that are already investing in Belize, and more want to come because they are looking at the Caribbean. And likewise, the Caribbean, like Grace Kelly and etc. and others, then can probably come to Belize and then add to the process and then send it into Central America. So we as Belize need to take advantage of that, but at the same time to ensure that then that CARICOM also can benefit just as much of the work that we're doing in working with Sika.
Yeah. Now, just looking at you mentioned President Giammattei. Will he be here on Thursday?
Yes, he has said that he'll be here on Thursday, and we're quite excited to have him. He's a really good guy. He's a doctor, and he's an incredible story, because he has he had problems. I think it was polio as a child, and there are many instances when I saw a short documentary when we're saying they were giving up on him, and he decided he was going to fight every day and live every day as if it is his last day. So it's quite admirable what President Giammattei has done with his life, and also trying to move Guatemala forward.
Yeah. Well, I know you're missing out on a lot of fun over there. I didn't realize.
I do have a lunch.
So much business.
I have a breakfast meeting with Prime Minister.
I didn't realize it was so much fun during the off time.
Well, yeah. You don't have a breakfast person, so I need to have my breakfast. I have coffee as yet, so
Oh well, all right. Kudos to you. We couldn't do this without coffee.
Definitely not.
I think for me the important point is for our viewers at home. Very often we see these high-level meetings and we don't understand what it means for us. How does this impact our lives? Right now, I do know that following the cabinet retreat, you talked about returning the 10% to public servants. It's bread and butter issues that matters to them most. How do you take a meeting like this and explain what it means for the average Belizeans?
Well, this is bread and butter in the sense that as a community, we could access the Green Climate Fund easier as a community. As a community, if we can get our sugar sold into Trinidad and Jamaica, the price that we get will be better. If we could sell our products or meat or vegetables, there's so much that we can sell. And that is how it's bread and butter. That is how it improves the lives of our citizens. But also internationally, that as a group, we have a stronger voice. We speak as Belize. I mean, 435. I like to joke, we're 435,000 plus counting. But we're like a speck in the sand, in the beach. But if we speak as CARICOM, we have a stronger voice, and the other countries would then need to look and to listen at us. For instance, Saudi Arabia right now is on a campaign to host in 2030, I think, the World Expo, the fair.
Yeah.
And they have come to to visit us as CARICOM, different countries, and the Minister of Tourism from Saudi Arabia came to Belize for the first time. But they came because they are looking at a block. They're looking at CARICOM, that if they can convince CARICOM to support them, it's about 15, 16 votes that they're going to be getting, as opposed to just coming to Belize. And so these are the ways, the bread and butter issues. This is how Belizean can benefit from being a part of a larger organization.
And PM is not only business, but we're also talking about the free movement of people for education purposes, for career purposes.
Well, we have done a lot of that in making sure that we can keep up with that, in ensuring that that Caribbean citizens can come to Belize, they can come to work. Likewise, Belizeans can do likewise in the Caribbean. Look at it, Carla Barnett, is the Secretary General of Belizean. We're very excited and proud about that. That our government, a PUP government, let's put it that way, campaigned very hard to get her elected, despite the fact that she was a former UDP minister. But when it comes to internationally, we are Belizeans, and we stand for one another, and we work for one another, we protect one another, and so we did our best to be able to get her. Of course, I mean, her qualifications are unparalleled, but it also required some political work, where I had to be speaking to several prime ministers and Minister Portney, doing the same thing with the foreign ministers, and encouraging them to support Carla Barnett. The free movement of people, we are one people, we're Caribbean people, and we need to be proud of it and take advantage of it.
All right. Well, we wish you the best in the days ahead. I know there's a lot to get to, and we appreciate you taking the time to talk with our viewers.
Well, it's difficult to say no.
But we gave you the best setting we could have given you, right?
Exactly. Look at this. I mean, so the next time you invite me, we're going to do it in San Pedro.
Okay, we'll send you the bill.
But thank you very much for the opportunity, and want to assure Belizeans that the work we're doing here it's not just that we're spending money, but it's something that is going to benefit bread and butter issues but also with the relaxations of what we've been having with the curfews and so forth. Also appealing to Belizeans to be responsibly, to act responsibly, and to get vaccinated. And if you don't feel safe, wear a mask.
All right. Thank you so much. We're going to go ahead and take a break. When we come back, April and Gavin take over in studio as they learn more about the National Health Insurance and the plans there. I know you got a lot of work happening there. That's coming up in a few. Stay tuned.
Technology is ubiquitous, and it's transforming how, when, and where we work. Fulltech Systems is placing award-winning devices in the hands of information workers, allowing them to work without compromise in a world without wires, to innovate, create, and to maximize productivity anytime, anywhere, satisfying the needs of the desk-centric remote and field worker and every other worker in between. We are providing the industry's best devices to businesses going through the process of digital transformation. Partner with us today to provide the solutions that will allow your employees to work effectively and efficiently to enhance your customers' experience. Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
Bundle the fastest, most reliable, unlimited broadband in Belize with your prepaid or postpaid mobile plan or Netflix. You can bundle your broadband with your prepaid and enjoy 50% off all national calls, plus get SMS and data. Paid plans? Then bundle with any speed and pay only $25 extra monthly to enjoy unlimited smart-to-smart calls, plus 500 minutes, plus 6,300 megabytes of data. Stream unlimited HD movies and TV shows with our broadband, plus the Netflix add-on for only $30 monthly, and enjoy streaming on your laptop, TV, phone, or tablet. Visit a smart showroom near you to sign up or upgrade to the bundle that's right for you. Smart, bringing people together.
I'm Jada Brown. I'm strong. I'm unstoppable. I am paddling for the rights of women and girls in Belize.
Hi, my name is Tina Herrera, and I'm paddling to end violence against women and children.
I'm Jasmine Armstrong, and we are paddling for all the women in Belize.
We are paddling together to break the bias.
Looking for low-cost television advertising? Have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
Been drinking all night. Feeling so high. Better not drive. Won't even try.
Been drinking all night. Feeling so high. Better not drive. Ain't gon' try. Been drinking all night. Feeling so high. Better not drive. Ain't gon' try. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. People die every day, I'm not going with ya. I'ma find my own way, I'm not going with ya. It's okay, I'll wait. Even good people make mistakes. I don't wanna realize when it's too late. Drinking and driving is never safe. If you're drinking and driving, I'm not going with ya. If you're drinking and driving, I'm not going with ya. Been drinking all night, feeling so high. Better not drive, ain't gon' try. Been drinking all night, feeling so high. Better not drive, ain't gon' try.
And we are back with our second session for today, our second conversation. We have in studio Dr. Ramon Figueroa, who is the Managing Director at the NHI program, and Dr. Marco Mendez, who is the Executive Chairman at the NHI program. Good morning, gentlemen.
Good morning.
Welcome.
Good morning.
Yes,
I guess we have to share a mic.
Yes, technical
Good morning to all, and it's a pleasure being here with you all.
Awesome. Well, tell us a little bit about, for the viewers at home that don't necessarily understand what the National Health Insurance Program is. Just a small little recap of what it is, what you all are about.
Well, the National Health Insurance is a program within the, I would say, providing health services to certain areas right now of the country. It started many years ago with the health sector reform project. It started in 1998. Basically, it had three main areas that it wanted to, let's say, reform. The organizational structure, also the services that were being provided to improve the services, and the financing of the health system. Yes, it is let's say, the NHI started in 2000. We are more or less about 22 years right now.
Yeah.
And it has slowly been expanding. It started in Bliss City, whereby a model of healthcare was being started to be utilized. We have a services that's provided by the private, by the public, and also NGOs. Then it expanded down south, and now it has went up north. In essence, I would say it is one of the best ways on how to provide universal health care. It is a primary health care that is wanted to be provided through the NHI, but of course it has slowly been expanding. I would say that the only way that we could provide our people with quality health care, with efficiency health care, and of course that there be accountability and a way on how we were able to sustain it is through the NHI. Okay. With the new government that just came in last year, NHI has been, I would say, most important reform that we would want, that the government would want it be accomplished. Not only because it will make primary health care accessible to the people, but all the factors that are involved within our health itself. We know that the most expensive types of diseases that are affecting us are the non-communicable diseases.
Yes.
Also infectious disease right now with COVID, but in a way, it is very expensive for our people to be covering those diseases. I mean, diabetes, hypertension, cancer, stroke, you name it. It is very expensive, but not only for our people, but for the country itself. So there has to be a way on how we are able to prevent that the people reach to the tertiary care, to those complications. And I think that is where the main focus of the NHI is driving, no? But there has to be that political will as to make it roll out.
So coming back to the NHI, the National Health Insurance, how is it that a person that is getting health care in the public or the private sector, how is it accessible to them?
Well, let me just go back a little bit. NHI, because I've been trying to see how I can explain NHI to people.
Yes.
Because I think a lot of people don't really understand what it is. As Dr. Mendes said, it's part of the health reform process. It's one of the byproducts of the health reform process. It's a financing mechanism. The best way I can explain it is it's a model of care that utilizes business principles in terms of driving access to care, efficiency, ensuring accountability, and procuring quality health care for the population. You can cover primary care, but the ideal is that you cover the whole spectrum of care, so that it comes from prevention, primary care, secondary and tertiary care. Depends on the ability of the country to afford the care. So, and you can construct it in stages, in phases. So right now we are, as Dr. Mendes mentioned, looking at primary care, some secondary and some tertiary, but eventually the ideal would be that we cover the full spectrum of care. How people access care is the National Health Insurance, as I mentioned, is a financing mechanism, and we purchase care, so to speak, on a contractual basis. So we contract with either a public facility or a private facility, and you can see it here in Belize City Southside, where you have Belize Medical Associates, Belize Healthcare Partners are private entities. Matron Roberts is a public facility. You have Mercy Clinic and BFLA that are NGOs. So we contract with entities to provide a specific health care to a specific region and population. So what we ask them to do is, let's say we start in the south side, because it's a geographically based scheme. People go and register with the facility. You need to have a social security card. You need to belong to the south side in this particular case. There are a lot of people from the north side who have managed to come to the south side. So once you register with that facility, then you're entitled to access to care really at no cost to you. We have some co-payments, a $2 co-payment for outpatient services, and a $10 co-payment on support services. So if you come to the clinic, you can come to the clinic as many times as you want. Once you're registered with the clinic, you see the physician, you get your consultation, you get your prescriptions if you require a prescription, and then you go to a pharmacy that's contracting with the National Health Insurance, and you get your medications with right now we have a 10% co-payment. So if your medications, let's say the total bill for your prescription is about $100, you pay $10 for it. Okay. The same thing for imaging services, and the same thing for lab services. So once you're registered with a particular clinic, then you're entitled to what we call a package of services that's defined in a contract agreement with providers.
And going back to something that you said earlier, speaking about the different levels of care, primary, secondary, tertiary, can you break that down, what those are, and sort of perhaps some of the services that people are able to access for the benefit of some of our viewers?
Sure. When we talk about primary care, it's basically outpatient care. So you want a general checkup, you're entitled to a general checkup. You have headache, fever. When the physician and the nurse and the health team assesses you, and they think that you have a more complicated situation, let's look at diabetes, all right? Basic diabetes can be managed on an outpatient environment. But you require a more specialized care. Let's say they haven't been able to control your diabetes, you need a more specialized care. Then you go to a more specialized level of care, and that's what we call probably secondary care. Tertiary care is really super specialized. Let's say you need neurology, you need a more specialized type of surgery, cardiac surgery, renal surgery. Those are more tertiary type care. But basically, hospitalized care is you look at it as secondary care. And primary is anything that you can deal with it in a clinic setting. But maybe Dr. Mendez can.
No, with primary health care, as for you to be able to provide quality health care, yes, it is very important to have the patient, to examine the patient, to talk to the patient, to have that time that we normally supposed to give to patients on everything, on the educational type. So right now, we know that when you go to the hospital, sometimes it doesn't take doctors try to, let's say, treat too much patients at a time, and they cannot give that quantity of time. So for this primary health care to be of quality, there has to be human resource. So for each 4,000 people, there's one doctor. For example, in Southside, any clinic, Matron Roberts, or let's put Universal, they have a population that they provide, that's primary healthcare services, 12,000 people. And for that, they need 3 doctors, one for every 4,000. Because you need to at least be there for 15 to 20 minutes, listening, giving that education, because that's the most important. The prevention is most important, but one needs to really examine the patient carefully so that it be of quality. And of course, for it to be very efficient, there has to be accountability. So whatever is spent in that, for that 12,000, it has to go to the people. More or less, that is what it is driving for, no?
One of the things that Dr. Mendez raised, which I think is important for people to understand, is that in any efficient system, one must go through the levels of care. So if you go straight to a specialized care, it costs more to provide the service. Right. So normally what you require in a very efficient and organized system is that you come in through the primary level. If you require a more specialized, then you're referred to that level. So the majority of people in health systems, the standard is that about 80% of healthcare can be delivered at the primary level. So it's more efficient. You deal at that level. If it requires more specialized care, then it goes to another level, because it costs the system more if people just bypass the primary level and go to a secondary. It costs the system a lot more. It's not efficient. In what we're promoting through the National Health Insurance is that you have that what we call the gatekeeper, which is the primary care physician at that primary level, and then if they require referral, then they go to a secondary or a tertiary level eventually.
Okay, so there are clinics that are registered with NHI. Yes.
That we contract.
That you contract.
With, yeah.
So what would happen then if there is a patient that would require a more diagnosis or a surgery from perhaps a medical facility that is not registered, but they had their diagnosis at one of the clinics that are from NHI, and they now need to go somewhere else, to another clinic that's probably not registered at NHI?
Well, when a secondary level care has to be provided, then they are referred.
Okay.
They are referred most probably to regional hospital if it is within the districts, or also to the cardiologist.
Okay.
Okay, so that is right now NHI only covers primary health care and not the entire country. Right? Here in Belize City, it only covers the south side. What we have seen, yes, with this model, whereby the private, the public, and also the NGOs, is that it is accepted. Even those 12,000 that have been assigned, they have registered up to 15,000. So by having those numbers, you could see that people really would want to be treated at those clinics. On the north side, we have seen with the statistics within the south side, especially with Matron Roberts, that people from the north side have been going to the Matron Roberts to be attended because they know that there is the services over there has been seen that it is of better quality.
And what is the plan, I suppose, for the expansion of these services beyond, to the rest of the country or, different locations?
Well, and I think everybody knows that one of the limiting factors in terms of us expanding the national health insurance, and in fact, in moving from the south side to the south of the country and then eventually to the north, has been finance, the limitations in financial resources. One of the things that we know for a fact is that from general taxation, government cannot be able to would not be able to cover the full requirements or the costs in the investment in healthcare. We want to talk about investment and not cost. So what we're doing right now is we're commissioning through the Pan American Health Organization a consultant that will do what they call a fiscal space study to look at different sources of potential revenues that can be then invested in healthcare. Because at the end of the day, government will have to probably pool from the different resources. We're looking at sin taxes, probably taxes on sugary drinks, on tobacco, on alcohol, maybe a lottery tax, different sources that would then pool and allow the government then to be able to expand to the rest of the country. But the limiting factor right now is a source of sustainable source of revenue.
I noticed, the biggest news is that you all have expanded into the Corozal district. How is it that you all process your research to where your next expansion goes? How do you approach where you go next? Because you are in the south, you're in Belize City, and now you're in Corozal. How is it that you go through that research and that approach to where you expand next?
Definitely the necessity. We all know that, for example, the south side had a necessity to have the accessibility to the services, no? But also, I would say, for this to be able to be done in a very structural manner, well organized, there needs to be separation of functions. Ministry of Health right now basically is the one that is in charge of the entire health in the country. So as for NHI to be very efficient, there has to be, ministry has to have only be the regulator, the policymaker, and see where the necessity arises. The NHI is the purchaser of the services, and then we have the providers, either be the public, the private, or the NGOs. The model that we have seen that is the most efficient one is the one that is in Belize City, where there is competition between them. Okay, and with the rollout to the south, to the southern part of the country, majority of them are public, and they has seen. We saw that the quality and the efficiency were not that as the south side, and that is the model that we are pushing ahead.
Why do you think that is?
Because there is competition between them in quality. The private being trying to see that it is more efficiency when it comes to administrating its finance. And of course, there has to be leadership. Once there is leadership on really seeing the objectives that one needs to strive for, then that will happen.
Yeah, going back to the question, basically we take our instructions from government. It's a policy decision as to where we roll out. When we went to the south side, it was because it was the poorest area, the most needy. One of the good things in that time was that the resources also are here. So you have a lot of private sector development that we can tap into. Because remember, when we're talking about the health system, it's not only a government health system. It's not only the Ministry of Health. It includes the private sector, it includes NGOs. So we need to start thinking wider, inclusive, including all those other resources, because they are resources for the country. When we moved to the south of the country was also the same issue. We wanted to go and cover areas where there was most need, poverty areas. Unfortunately, in the south, there wasn't that private sector development that allows us to then contract with private sector and create that competitive environment that we have here in the south side. So there in the south, we had only contracts with public facilities, and one of the things we've learned over time is the public bureaucracy is extremely difficult to move. And that's a constructive criticism. I mean, I think everybody knows that. It's not to put down, it's just difficult to move that bureaucracy. So one of the ways we have learned to do it here is to create that competition on performance between the different providers. And that seems to work. Because the financial part of it in the private sector, if you deduct a payment because they're not meeting a contractual obligation, in 1 week or 2 weeks, that thing changes. In the public sector, when you deduct the payment, it probably takes about 2, 3, 6 months before something moves. So that's a sort of that's why we believe that the best model, as Dr. Mendez mentioned, is to have a mix of public, private, and other NGOs that creates that competition, not on prices, but competitions on performance and quality.
So that is what you're seeing in Corozal.
Well, in Corozal, that's why we're introducing now a private entity to provide that service. Because in addition to that, there was a limitation in human resources and in the north. And you're expanding the little resources you have to cover a wide area when the private sector is also there. So the notion for us is, listen, public sector, deploy your personnel to other facilities and allow the private sector to come in and provide that service. It's not, and again, we want to be clear because some people are saying we're privatizing and selling out it's not. We're leasing the facility and allowing the private sector to come in and provide a much needed service in that area because they have the resources. And then create that sort of competitive competition between the public facility and the private facility who can provide the quality care, coverage, and access to the population.
Do you have any future plans for new coverage, new approaches within the next year or two with the NHI?
Maybe Dr. Mendez can talk a little bit more about the expansion because this year in our budget we have included expansion to Orange Walk.
Okay.
So, but maybe
So, well,
he's from Orange Walk, by the way.
Oh, that's why.
Well, that's not the reason. That's not the reason.
And not only because of the minister. Well, yes. Well, we have seen that. Yes, they definitely the best model of care for the NHI is the mixed model, and that is why Corozal is being included as part of it. No, but also we are at the end of the year. It is within the budget for expand to Orange Walk, and then later to Cayo and also the northern part of Belize City. But also we are increasing the quantity of registered people for the south side because we have seen that the clinics are now registering more than the 12,000. So each one of them is going to be expanded 4,000 more. And it is 4 of them, right? So it's going to be about 16,000. So 16,000 more additional for the end of this year. And April, it is very important to really see that in Belize, the poverty population, we have a poverty of more or less about 50%, okay? And that was many years ago. With COVID, it has increased. And out of the pocket spending of people, it is very high, more or less about 30 to 35%. That is really something that needs to be refocused if one is going to be providing universal health care. And the only way that it could be done is through the NHI, and it has been proven in other countries. We went to Costa Rica just about 3 months ago, right, Dr. Figueroa? And we have been having some conversations with an exchange with Uruguay. In Uruguay, they started their reform and the national health insurance when 22 years ago, when it was being introduced here. And for them, worldwide, at least in Latin America, they are one of the best. So it has been proven that yes, it does provide universal health care. And of course, your stats in when it comes to health improves.
I think the point that we need to make is that, because a lot of time when we ask about how I'm not going to finance it, or how, we have to invest in healthcare, all right? And the fact that the government probably can't invest more than what they collect in terms of general taxes doesn't mean that somebody is not paying for healthcare, because people are paying out of pocket in an inefficient manner. So somebody is paying for healthcare. What we are proposing in terms, when we look at fiscal space and all that thing, is how do we consolidate and those different revenue streams, even out of pocket expenditure, because you might come to, who knows, we might come to the population and say, listen, let's have you pay maybe $30 a month towards the health fund. That's cheaper than any other insurance company in this country can to provide healthcare, optimal healthcare. So let's get this notion that if that we can't afford, we have to, because if somebody's paying. If the government is not paying for it, you're paying out of your pocket for it. We have made the calculation about what, and those are very low estimates of what a person who is diabetic and hypertensive pays per month once they're diagnosed with hypertension. In the best case scenario, they're paying like $300 and something per month for life once you've been diagnosed. In the majority of cases, they're paying $500, $600 per month. We have done our estimates of what it would cost to pay, let's say, for full coverage countrywide at the primary level, to about, and I mentioned $30-something per month, and that's at a maximum, right? So we have to be able to afford the investment in healthcare, because there are people out there who are being pushed into poverty because of the healthcare need. You don't plan to get sick. You get sick. And when you get sick, you find ways of trying to get better. You sell off your land, you sell off your mortgage of your place. So it's not a question of whether we can't afford. We have to afford.
I mean, well, I think that sums it up perfectly right there, but I wish we could have more conversation, but I think we're a little bit way over time. So I would really like to thank you both for coming in, discussing the new reform, the new national health insurance. And I think we'll be hearing more from you all in the next coming weeks when it comes to the Corozal approach, yes?
Well, if we invite, again, it depends if we get the approved budget, then we'll roll to Orange Walk and make adjustments here in the south side.
All right.
So it's all dependent on.
Well, then I guess we have to have them back for another discussion. But thank you both again so much for coming in.
Thank you, and thank you very much.
And with that, we will take a short break, and we will come back to have our second segment, our last segment, sorry.
Digi, the premier name in voice and data, is also the country's leading provider of innovative services and solutions for small business and enterprise. At DigiBusiness, we offer solutions, tools, and applications to support your business needs. Reduce costs, improve efficiency, and excel in a changing world where no idea is too big and no task is too small. From technology advising to design implementation and management, our team of qualified solution sales and specialists can develop a reliable and robust infrastructure, allowing you to spend more time on what matters most, your business. Visit us online to explore how DigiBusiness innovative products and solutions can help your business reduce costs and improve efficiency.
Galenia Hospital, located in Cancun, Mexico's premier tourism destination, is a state-of-the-art healthcare facility that provides highly specialized medical services. We are Quintana Roo's biggest private hospital with board-certified doctors and staff. Some of our services include cath lab, adult intensive care unit, neonatal intensive care unit, emergency rooms, operating theaters, ambulance services, and more. We are a medically accredited hospital by JCI, Accreditation Canada International, and General Health Council, providing extraordinary care in every specialty, from our cardiology department to our neurology center. We are focused on treating the entire person, body, mind, and spirit. Contact us at medicaltourism@hospitalgalenia.com or visit our website at www.hospitalgalenia.com. Come to Galenia Hospital in Cancun for a truly personal medical care experience.
Why should you wear your mask? To protect myself. My friends. My family and others. I wear my mask because I love my grandparents. With so many reasons to wear a mask, we continue to advise persons to wear a face mask properly, covering both nose and mouth. Together, we can keep Belize COVID-19 safe.
Your life just got a lot less complicated with Belize Bank Contactless MasterCard Debit Card. Introducing our Standard Debit and MasterCard Platinum Debit Cards. Now you can make purchases anywhere MasterCard is accepted with one tap, pay and go. Your contactless card never has to leave your hands, especially in these times. And your card is embedded with multiple layers of security. Platinum card holders get to enjoy extra benefits like price protection, purchase protection, trip inconvenience, and luggage protection, just to name a few. Start enjoying a cashless lifestyle today with the Belize Bank.
Okay, students, let's focus now.
Teacher, yes, teacher.
Can anyone tell me what sustainable development means? Ganzi?
Huh?
Anybody?
Teacher. Last night my dad was talking about sustainable development and he said something about people and nature and something else. Oh, and money.
That's good. But did you ask your dad what sustainable?
And we are back. And if you are joining us right now, we are just getting our third and final conversation for this morning started. And as we mentioned in the beginning of our show, March is Women's Month,
Yes.
and we are talking all about it. And we've got representatives from the. We have a representative from the National Women's Commission joining us via Zoom this morning.
Good morning.
Good morning. Hi. How is everyone today? Happy Women's Month.
Happy Women's Month.
And we're doing great. We're glad to have you on our show this morning. So for the benefit of some of our viewers, can we perhaps just start off with just a little bit of background as to what Women's Month is, what we are really celebrating, and just some general information.
Sure. Well, Women's Month is dedicated entirely to the celebration of women. During 16 days, we do a lot of advocacy, we do a lot of work to expound upon the seriousness of gender-based violence. But during Women's Month, what we do is we talk about all things that affect women, all things that affect gender. So it's more holistic. We're talking about the way, for example, our health systems interact with women. Are we getting the services that we need? We are talking about women in education. We're talking about women in politics. We're talking about everything that women deal with, and we so it's a more holistic approach. We celebrate women during Women's Month. We observe Women's Month. It is also a celebration of, as Minister said in her speech, she has a Women's Month message that has been released this morning. We celebrate ordinary women, ordinary Belizean women who have done extraordinary things, who are nation builders. And sometimes we need to highlight women and the importance that they play within our society and within the larger Belizean community. So that is what we do during Women's Month.
So what is it that the National Women's Commission has planned for the next 16 days? I know that we are celebrating under the theme, Break the Bias.
Yes, well, the National Women's Commission does team up with all of its partners. But what we do also is that we coordinate the activities. So all our partners, all our stakeholders, from the Women's Department, the Police Department, and the women in the Police Department, we have to give them mad props and credit, because they have really stepped up this year, and they have really organized through the length and breadth of the country, and have a plethora of activities in every district. But we also have the municipalities stepping it up and partnering with us this year, the Office of the Special Envoy, and we have a few political groups here and there. The United Women's Group has asked to become engaged and to be able to participate, and so we don't turn anyone away. And what we do is we highlight women. We want to advocate for them to receive the services, and we want for them to be active participants in their faith and in Belizean life, Belizean community.
Other NGOs or other stakeholders that are not official partners with you all, how can they join the National Women's Commission for your month of activities?
Well, for example, you can reach out to us on Facebook. We have a website. We are on YouTube. We are, I believe, on Instagram. And so you can reach out to us there. We are on the corner of Dean and Regent Street. You can walk right in. Send us a message, and we respond and we get it going. There's different ways you can partner. We're having with the municipalities. We're having little pop-up shops, little how to say, business or entrepreneurial fairs. And so we're having one, I believe, in every municipality. For example, the first one will be this Friday in Corozal. And what we do is we coordinate, we organize, and we have asked the Women's Department to come in. We have asked different, not only entrepreneurs, there's a big group of female entrepreneurs there. I think they're about 25 strong, so they will be participating, and they reached out through the municipality, through the town council, and we are getting our gender advocates because the National Women's Commission also has gender advocates. We had been advertising really heavily to get people to volunteer. It's a voluntary post, but we give a lot of training, and now we have gender advocates, especially in rural areas all across the country. And so the gender advocates are also going to come in. They're going to be giving a lot of information. We have asked the Ministry of Education, for example, to tell us about scholarships that may be available. They're doing a lot of work with STEAM, science, technology, engineering, arts, and math, and trying to get more women and young girls, young women involved in these areas. And so there's a lot of things going on, and we're trying to bring and coordinate everything together. I know the Ministry of Agriculture also has a lot of, they even have a gender focal point, which is another thing I would want to tell you about every ministry, and we're coordinating that also through the Women's Commission, has a gender focal point now. And so the group of gender focal points, the Ministry of Agriculture also has one, and they have a lot of programs that encourage women to participate in agriculture. And so they have a lot going on there. And so we try to tie all of these in and have the information out there for women so that they can access. We also partner regularly with Beltrade, who has a lot of information and a lot of small grants and micro and small loans that are geared to empowering women financially. And so we invite all of these women. So we want to invite all the women to go out, to look out for these pop-up shops. They're called bazaars in some areas, but they're coordinated through the municipality, and we invite you to come out, take part. If you want to take part by bringing out whatever it is that you are selling or you want to promote, go right ahead. You can coordinate that through the municipality in your area. You can certainly call us and we will point you in the right direction. And as you can see, we have many, many activities. And if you want to include your activity in that calendar, please reach out to us. We will be more than happy to do that. And,
before we talk about some of the activities, I just want to go back to the theme a little bit, break the bias.
Yes.
I like the theme a lot. So can you tell us a little bit about how you came up with the theme and why we chose that for this year?
Well, I would like to take the credit, but like I said, at the Women's Commission, we are tasked with organizing and coordinating the efforts of a wide range of partners. And it was the partners, we have a meeting, we coordinate, and they're the ones that voted. There's a few other choices, but it was felt, I think, by and large, that break the bias. Women are still, there's the big barrier to us moving forward and being empowered is actually bias. And so by breaking the bias, breaking the stereotypes, we are breaking down a big barrier that holds us back, that oppresses us and keeps us from realizing our full potential. And so, we want to break the bias.
I think based on the activities in the calendar that you have, it kind of speaks for itself a little bit. The agricultural programs, the STEAM programs, the women in IT, the women in entrepreneurship, agriculture, and so forth, because those are technical areas where it's a male-dominated field. Sorry, Gavin. So that I think is I think that the activities speak for themselves. So you said it's only 16 days?
No.
It's the whole month. The whole month.
It's the whole month.
Okay.
Yes. 16 days is we focused on the eradication of gender-based violence, but for the month long, what we do is we celebrate all things women. We try to engage women, and we are trying to coordinate with other ministries, with other sectors, government and non-governmental, to try and make sure that we get information out there. And what we're trying to socialize right now is our gender policy and the action plan. And so I am hoping that you will invite me back somewhere down the road in this month so that we can speak specifically to those two documents that we're trying to socialize, and we're trying to make sure that we get the information out in the public as to what they are, how they work, what it would accomplish for women specifically in Belize.
Can you tell us a little bit more about where certain people can find pop-up shops around the country?
Like I said, they're going to be all month long, and they're usually either a Friday or a Saturday in the municipalities. So in the major town in Corozal, I know it will be held right outside the town council. They block the road and they make it available. It's going to be, I guess, maybe from about 9 to about 2. And that is going to be this Friday, I believe. But look out for it in the town council. The town councils are usually, I know San Pedro is going to have one. Orange Rock has already confirmed, and so on and so forth. So as we get them, you can look out for them, and if you follow the National Women's Commission on Facebook, on Instagram, we will put out the notifications there and keep you informed as to what is happening for women this month especially.
Okay. Well, Thea, we are unfortunately running a little bit out of time for this segment, but are there any other final thoughts that you'd like to share with our viewers as to what they should look out for or what they should be taking advantage of during this Women's Month?
Well, I am told that the pop-up shops will offer special discounts for women. Like I said, look out for a lot of information to be coming your way on the gender policy, on the action plan to implement that new gender policy. Look out for us to be highlighting what other governmental and non-governmental stakeholders are doing, for example, specifically for women to advance women. You know, I'm sorry again to say, Gavin, but women are 55% of the population. So we are in fact the majority. And so we want to make sure that women out there know that we need to highlight them. We want to especially look out and encourage them to participate in politics because we need that representation. And the village councils are coming up, I guess, sometime around or after Easter. And we want to encourage all the ladies, especially in the rural areas right now that it's village council, to put their name on that ballot, to participate, to represent. And so that is another of our thematic areas that we are hoping we will be able to strengthen this year. Currently, out of the 196, I believe, villages in the country, there are only 25 chair ladies. And so we are hoping that by the end of this cycle for village councils, we will have made sure that we increase that number.
Women can lead, and you break the bias that way. Well, thank you so much for coming to talk to us, Thea, and hopefully we'll have you in studio when we discuss more about that gender policy.
Yes, I am always available. Thank you for having me again.
Thank you.
And thank you for making sure that the Women's Month started out with a bang. Like I said, Happy Women's Month to all of you and all your viewers. And thank you for having me.
Thank you, Thea. And with that, we are going to take another break. And then when we come back, we will be having Trending Talk Tuesdays with Gavin. Stick around.
The Social Security Board, in collaboration with the Labor Department, takes this opportunity to remind insured persons of the requirements for compensation when on sick leave. Any employee who has worked with an employer for at least 2 months is entitled to 16 working days of sick leave with full pay every year. This is how it works. Upon approval of a sickness or injury benefit claim by SSB, 80% of the employee's weekly insurable earnings is paid as a Social Security benefit, and the difference in the employee's salary is paid by the employer. This is to ensure that the employee does not suffer any loss of wages when ill. After 16 days, compensation for sick leave is paid as a Social Security benefit only. Some conditions apply. This message is brought to you by the Social Security Board and the Labor Department. Social Security Board, safeguarding you, your family, your future.
It's almost lunchtime and Alice is getting hungry and forgot to bring cash. She remembers that eCash now has a geolocation feature in which she can easily view the eCash merchants near her, especially restaurants. Her co-workers also ask her to order food for them.
Chicken chow mein, please, and a Coke.
The merchant sends her the payment link. She taps confirm, and within a few minutes, her food is delivered. Alice then views her transaction history and taps on the transaction recently made. Then taps the split the bill button where she selects the unevenly option and moves the bar to the desired amount per person. The request is then sent to her friends. Her colleagues accept the request and are ready to enjoy their meals. Geolocation and splitting the bill via eCash make Alice's life a whole lot easier.
It's a fact that your credit lasts longer when using Smart. During these times, we're all trying to find ways to cut costs and save the little resources we have. With Smart, it's easy to do that. It's a fact that with Smart, your credit lasts longer. You can call Smart to Smart and Smart to Digi using your promo credit, while with the other guy, you can only call on-net, Digi, or BTL numbers. What does this mean? You get to call any national number using your promo credit. Your promo credit is free, so that call is also free. Know your facts. Don't be tricked by the other guy. Be smart and save your dollars.
If you're looking for low-cost television advertising, have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health.
And we are back. And if you are joining us right now, we are almost at the end of our show, but because it is Tuesday, we are going to be talking about some trending topics that have been buzzing on social media over the past week or so, because it is Trending Talks Tuesday, and that's when I talk about what people have been speaking about on the different social media platforms. And this week, we're going to start with a meme, a new meme, which was making the rounds last week. And of course, If you are an NBA fan, you might have already seen this one already, but Adele was courtside at one of the games last week. She usually makes a lot of headlines just for what she's wearing and how she looks, but last week there was a funny meme when the camera panned to her and she was trying to look distracted and not really focus on what was going on, so people ran with that and they started making a lot of different memes out of Adele and her face trying to avoid. So that's the original picture that started going viral, and let's look at some of the tweets and some of the other memes that came out of using Adele's face. So yeah, we've got one. There we go. Me pretending not to see my grandma opening her wallet to give me money. That was one of the good ones that made me laugh. Let's see another one. So that, you know, the point of this meme is that Adele is like trying not to look or pretending not to see. There's another one, me avoiding someone when I see them in public. That was generally like the theme of these memes. I found them super interesting. I think there's one more. After this NBA one, but that was one. Oh yeah, that was one. That was another good one. Okay, and then the headline for that tweet that we just saw was me after typing that I'm screaming. A lot of people always make a joke out of that one when they're saying typing LOL or LMAO, and then they have a blank expression on their face in real life. But that was the first trending topic that I saw. It was a new meme, and I think that it was super funny. But that was one that was buzzing on Twitter and internationally. Now, turning to some of the local trends, one of the biggest ones which I found really hilarious was, as you can see on the screen, some of our ministers and a lot of our very recognizable public figures got a bit of a makeover on social media last week. A few months ago, I did speak about this trend which started on Twitter, and it's called yassifying. And that is when basically you take a picture of somebody and you put it through a filter which makes them look super photoshopped, either with makeup or just to enhance their facial features. So of course somebody took some of our public, I recognize that guy. So somebody took a lot of our public figures, put their faces through the filter, and of course this was trending all over social media, and I found them really hilarious just looking at not only the pictures but some of the comments that people were leaving under these pictures, talking about seeing people in different lights and talking about who's the most attractive or stuff like that. But I found it really funny, of course, because it's all a filter, and making some of our well-known figures, seeing them in a different light was really funny to me. So we have former Prime Minister Dean Barrow, we have current Prime Minister John Briceño, we have Senator Elena Smith, former Attorney General. And it wasn't only the ministers who got this treatment. We can see Commissioner Chester Williams, Commissioner of Police there as well, Dickie Bradley, and Lee Mark Chang. So I mean, nobody was spared, and I think we even saw them yassify some of the two men who appear on our flag. So that was really funny. I think this first popped up on the Belizean Rice and Memes page on Instagram, but of course it went viral. It was all over Facebook. Got a good laugh out of it. There's my dad. And so that was the second big trend that I saw this week. And then our final trend, of course, we started off the beginning of our show with the big announcement that the government did make that the curfew is over as of today. And of course, because of that, people were overjoyed, people were happy, but they ran with it. And as we can expect, there were lots of memes talking about that as well. So as you can see on the screen, people, here's one of the ones that was very popular, talking about people tired of curfew, and who appears Kevin Bernard to save the day. So a lot of people are happy with Minister Bernard. Somebody says Happy New Year, of course, because that is what it feels like after about 2 years of being under the curfew. And next one, Prime Minister, no curfew, me topped up the Gute account. So it's really, so a lot, see more statuses and you need to go up on the street tomorrow, but I'll find an excuse to go. And I know a lot of people who feel like that as well. There's another one talking about if you think because no curfew you won't come in at this house 3 or 4 in the morning, you better move out, of course, and there's somebody packing their bags. So lots of people are very happy that the curfew is over. The Ministry of Health is advising that we've also eased some more restrictions. So lots of people have been talking about it on social media, of course, and lots of people have been making memes. So I found those really funny, but those are just some of the trending talks that were buzzing on social media this week. Of course, if you have some more trends that you want to see or you want to talk about, feel free to suggest some to us. We like memes, and you can you always talk about it here. So April, did you find some of those funny?
I mean, no curfew, right? But where we going?
Right? I know. That's one of the biggest things. For sure.
Well, as always, we would like to thank you for your trending talk Tuesdays. And we hope that our viewers got a kick out of it. And of course, one thing about Belizeans, we find out how to make a meme out of everything.
Oh yeah, always.
We don't make a meme out of everything.
Yeah.
That's the talent.
For sure. Yeah, absolutely. And keep doing it,
Yeah. Because then you need your topics.
Definitely,
for
we got to keep this going.
Yeah.
So keep making your memes.
But of course, with that said, our show has come to an end. And we would like to thank all of our viewers for tuning in, of course. And of course, we'd like to thank all of our conversations. We'd like to thank all of our guests for coming in, those by Zoom and those in studio. We had wonderful conversations. We will be tuning in for the rest of the week with Marlene and Paul on San Pedro to see what are the hot topics that are taking place there and what are the conversations that are happening there for the rest of the summit this week. So just tune in, 6:30 every day, and we thank you all for being here.
Yes, and of course, if you want to contact us, you can send us an email at oie@channel5belize.com. You can also find us on Facebook at OpenYourEyesBZ and on Instagram at OIEBelize. And as April said, we will be bringing you live coverage of the CARICOM Heads of Government Summit, and we'll be giving you all of those events for today and tomorrow. But that is all the time we have for today. So until tomorrow, when we see you tomorrow at 6:30 a.m. for Open Your Eyes.
You start your morning, right?
Yeah. Until then.
Be sure to keep your eyes, your minds,
and your heart open.
See you soon, please. Take care.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.